Hi, Elizabeth here, and today I want to talk about Mandibular Tori. Mandibular Tori? What the heck is that? That's exactly what I thought. I'm here in the USA hanging out at a campground, and I went to visit my sister, and she has them too, and she had no idea, just like I had no idea, till I started doing some research. Why did I start doing some research? Because, one thing I say is don't start looking things up on Dr. Google. It's just gonna be a nightmare. But this was something I looked up because I stopped wearing my retainer years ago when I was in my 20s. I'm not in my 20s anymore, and I stopped wearing it years ago because it didn't fit. Why didn't it fit? Because I have Mandibular Tori. I have Mandibular Tori, and that's why it didn't fit. Basically, those are bony growths in my lower jaw. Bony growths in my lower jaw? What's going on? Psst, a little secret. As far as I understand, it's called Mandibular Tori when there's multiple, and Mandibular Torus when there's only one. Yeah, it's kind of this benign, weird thing that happens to 5 to 7% of the population, so not too many of us. We're the lucky ones. Not so lucky. Where it just grows, and generally it's not a problem. Nothing needs to be done, nothing needs to be taken out unless it gets overwhelming, in which case, for example, I'll show you a picture where you can see mine where they're coming in a little bit from each side. They tend to be, from what I understand, I'm not a doctor, this is not my profession, I'm not a dentist or an oral surgeon, nothing of the sort. But they tend to be mirror images of each other. Not exact mirror images, but if it grows on one side, it's probably going to grow on the other side as well, which is what I have and what my sister has. Actually, I think she has on one side. I'll have to check. But basically, they're benign, which means not cancerous, not a problem, bony growths in the lower jaw. Mandibular Tori. There's another word for them if they're in the upper jaw, but I'm not sure what that is. Maybe I'll write it here for you. But basically they grow, and they tend to grow, and it's not a problem either due to genetics, in which case they show up in your 20s in your adult time, or due to stress. I don't know what mine are. I'm assuming genetic since my sister has it too. But there's no need to do anything about it. There's no need to remove them. There's no need to have surgery unless they're causing a problem like pain, or they're making it difficult to eat or to speak. So for example, if you see mine, they're on the sides and they're small, it's not a problem. I barely notice them. But for some people, they go all the way across their mouth, which then lifts their tongue and makes it difficult to talk, for example. And it can be something that's maybe worth the surgery. So I want to talk about these because that's why my retainer didn't fit. And I had the pink acrylic plastic retainer, which sits in your bottom jaw. And because I had bony structures pushing up, it couldn't sit in my bottom jaw, which is why they said just don't wear it anymore because it's not going to work. They should have maybe thought of a different type of retainer, which would have helped me, but they didn't, which is why my teeth started shifting and I got to the problems where I am now. And this tooth, my eye tooth, pushed on my bridge, which made that come off, and here we are, 45 years old, and I'm getting braces again. So that's why I have braces, and that's why I have braces on the bottom. So why don't I have them on the top? Because the Maryland bridges need to come off first, and I'm still waiting for an appointment to get them off. Maryland bridges are basically a fake tooth with 2 wings on the side. This one's already off, so I'm trying to clean underneath it, which is pretty sketchy. But the other wings are still attached, so I have to find a time when the specialist is available and when I'm available so that we can get them off without trauma, because we don't want to damage the other teeth that they're connected to. I want to keep what few teeth I have intact and usable. I love my teeth. I want to take care of them. So that's why I'm investing now. Another question I get a lot is, why metal braces? So I live in Vienna, Austria, and there the insurance does offer a little bit of coverage, except Although the price for both the Invisalign option or plastic tray option of whatever type and the metal braces both offer coverage, and the price is about the same, the end cost for the customer, the insurance coverage is not the same. So with insurance, they will give up to 500 euros, which is about $500 right now, for the metal ones per year. They will give up to 70 euros or $70 per year for the plastic ones. So that's a pretty big difference. Now, up to, that means from 0 to 70 or 0 to 500. So if you're getting 0, it doesn't matter which one you get. But I was originally thinking of doing canine substitution, which my orthodontist told me he was only willing to do with metal braces. So I went with the metal braces. It seemed like a good option. Am I still gonna do canine substitution? I don't think so. I don't think that's the route I want. But I'll have to keep you posted as we make each step through this journey.